everyone. I know right now is a really difficult time, especially when it comes to finances and health insurance and everything that's going on in this crazy government. So, I made a post on Badass Bodyworkers that I will be making a video on how our health insurance premiums have changed. So, here's some of the comments from that thread. My policy is going up to $100 a month if I stay on the same plan. I had to have back surgery this past summer, so I feel like no insurance is no longer an option, especially as a single mom and a one income household. Kids are covered by their dad's insurance. I opened a largest wellness facility last year and still not back to bringing a stable income, so this is hard. I don't know if this is available for everyone, but I got into direct primary care, which is a monthly fee. I paid $100 a month and had access to my doctor anytime I needed. Prescriptions were at cost. My first appointment was 4 hours long, where we reviewed my full medical history, and it didn't cost any extra. I also had a text number where she could be reached and also did emergency care. Others have and will go up quite a bit this year. We have paid anywhere between $4 a month up to $800 a month for family of four with extremely high deductible ranging between 5K and $17,500. Holy shit. It has increased nearly every year. We only have it for emergencies. We pay cash for all of our care and use monthly alternative health care. We also have an accident and injury supplemental policy for each family member, which would kick in and pay for office visits, hospital visits in case of an accident. That is through Globe Life Heritage. I highly recommend checking them out. It's very affordable. And if you haven't used them after a certain length of time, they do a return a premium. So they write you a big fat check. Oh, that's nice. I didn't know that was possible. A friend of mine named Kathleen Winslow sells the product. Let me know if you want her info. Every time I start freaking out about price going up, I remember we have the supplemental plan for a reason and it calms me down. I'm pretty sure you can have supplemental plan even without major medical insurance as well. I live in a state that requires health insurance by law, and me and my spouse are paying way too much to begin with. I don't know how I'm going to afford it once it goes up. I had the same plan this year and last year, and it went up $70 a month from last year. Not excited to see what's going to be for next year, considering this is the most I've ever paid for health insurance, and it's apparently going up exponentially. You're not wrong about that. My husband and I are both self employed, so we went through ACA, although we never qualified for subsidies. 2 years ago, I dropped out of the marketplace when our premiums was $1,100 a month and 10K deductible per person. Wow. I'm in Ohio and have been using short-term casualty insurance since then. $250 to $300 a month for a premium. Deductible still high, but it reduces the rates of all my visits and tests, so I get basically the same benefits I had with ACA. The network is also wider, as in choosing a doctor, than the marketplace ever was. You are only allowed to be with the provider for 4 months at a time, so I find 3 providers for the year. I will look up Marketplace just out of curiosity, but I assume for me, my husband, and my son, the premiums will still be $1,000 to $1,500 a month. This is not sustainable. No, it's not sustainable, especially when other countries have universal or free healthcare, affordable healthcare. Good God, like I can barely afford my rent, much less paying these insurance premiums. And when we're in a spot where we have to make a decision of paying our health insurance versus putting food on the table or paying our rent or taking care of our staff members, that's unacceptable. For my family and I, it's getting harder to find affordable coverage with the same benefits and procedures covered. It's a slow erosion of procedures covered over time. At some point, it might not even be worth paying for coverage, which barely covers anything. I haven't met my insurance person yet, but I'm definitely want to be a part of the thread. Many years ago, I decided to forego being an independent contractor and I'm an employee at a small medical spa. I'm grateful that my employer offers insurance. The first few years it was free. The last 2 years is $425 a month. They use Redirect Health. I like them. I now barter for 50-minute massage services per month. I feel like it's a pretty sweet deal. I'm unmarried, no children, 57 years old, good health, not on any medication. My question to this is you're on a barter, right? So what happens if you have to cash in on your insurance? Are they going to try and wiggle their way out of it because you didn't pay, you bartered? You know what I mean? I have a Blue Cross Blue Shield local PPO plan and it's increasing from 450 to 670 on January 1st. I make too much to qualify for any kind of subsidy the last 2 years anyways, but this jump in prices has me reeling. I'm going to have to switch to a very high deductible with crappy coverage, and I'll probably still be paying at least $400 a month that you probably can't even fucking use. The more and more I read these comments, it's starting to make me hate living in this country, I swear to God. The current plan, which is so basic and high deductible, has increased by over 100% last year. I'd like details on this because I very specifically asked people to share numbers, and that would be really useful. I'm on TRICARE as a military department, but I've had lots of sad stories. Okay. I don't know what those sad stories are. Feel free to share if you like. Spouse and I are changing plans because it went up again this year. We have a high deductible plan and each of us has to hit half before insurance will pay. We were at the high end of what we could afford and it's going up by $400 a month. Switching plans is our only option and he makes good money many more times than I do. Tell me again how paying health insurance premiums higher than our mortgage and having a high deductible is better than universal health care. Make it make sense. Ugh, I am totally with you. It's absolutely fucking insane. This is a basic human right and we're literally being punished for it. I personally don't have health insurance and I get penalized in my taxes for it, which is absolutely fucking bonkers. Hey, some more comments. I haven't looked because honestly, I'm scared. Whew, I feel ya. I get $650 a month in government subsidy. From what I understand, that's going away. I've always had good health insurance coverage, even though I rarely use it. I pay $104 a month with a $3,200 max out of pocket. So basically, everything is covered. I'm preparing myself mentally to go uninsured or get on Medi-Cal, which is in California. I'm working on a full-time massage office job right now because of health insurance costs. My husband works for a small company that doesn't cover spouse's health insurance. I miss massage, but I had knee surgery this year and lots of imaging, doctor's appointments, and physical therapy. If I didn't have health insurance, I would be so screwed. I was uninsured my entire adult life, couldn't afford it, same, until I married my husband and got on his health insurance plan through the company. Well, I'm not married. Would likely be uninsured again if that were to happen. I've been paying $600 a month for more than a decade for PPO I never used. Last year had an out of office procedure that set me back $7,000 out of pocket. Switched to a HMO for 2025 for $330 a month. As of now, I'm expected to pay $800 a month in 2026. I've always had it as self-employed massage professional the past 25 years. It was something that my parents scared me about not having. I'm perimenopausal, have Hashimoto's, asthma, fibromyalgia, migraines, anxiety, depression, all of which are manageable with lifestyle and medication. So I have no idea what I'm going to do. I'm going to look in December. We paid for private insurance. Even that's ridiculous. So if it's gone up even more, I can't find something. My husband and I are going to lose health care. I don't know if we can afford as he is on daily medication. Luckily, I joined the military a year ago. I had VA benefits. Would hate to know if I had to pay the prices for insurance. I was paying $610 a month this year for health insurance for myself with the deductible of $7,500 with Blue Cross Blue Shield in South Carolina, only to find out I had to pay out of pocket for endosurgery because no specialists were in network. I can't afford health insurance now, so I can't imagine what next year's options will even look like. I'm lucky to have an amazing boyfriend. We asked about domestic partnerships if we were not going to get married because I don't think I can afford $1,200 a month for health insurance. Even within, it's going to cost me within network is going to cost me like $600 and I currently pay around 400. I could do more at my hotel job to get that covered, but I'm already overwhelmed and overworking with my own business and that quite honestly, I'm thinking of closing it. It's just all so much. Oof, I feel you, girl. Seriously, so crazy. I got quoted for a family of three, $900 a month with the $16,000 deductible. Totally unrealistic. Haven't had insurance in 12 years or any wellness checks either. Feeling blessed, my husband found a good job to help support us in that avenue. Previously, I had to get a passport for the idea of traveling to Mexico for health and dental care as needed. Our government and welfare systems are complete trash. Not disagreeing with that. I've been uninsured for most of my massage career, over 18 years, occasionally paying out of pocket for insurance when I need to get something significant done. I'm not sure what mine would be going up, as I ended up dropping it because of the already high cost last year. I've used HealthShare in the past and currently have short-term plan for emergencies. I joined as a direct primary care model that is low priced and able to run lab work at cost. Previously, I used sites like Walk-in Lab or Ultra Labs because they are cheaper for going straight through Quest or LabCorp. As a self-employed person that always uses a bronze plan, my premium is going up by $200. So a bronze plan with the $6,000 deductible is $450 a month. I've only had health insurance for the past 3 years from Marketplace. My premiums have increased considerably, and I don't expect I will be able to afford the coverage in 2026. This is the only time I've had health insurance in my entire adult life, as I have been mostly self-employed. I guess it was good while it lasted. I'm 58. I'm in a few years away from Medicare, which these days seems iffy too. I had to stop doing massage and get a regular office job with insurance for a few years when husband's job didn't offer any health plans. I'm type 1 diabetic and supplies and insulin are outrageously expensive. There's no way I could afford a private plan plus the cost of my healthcare supplies. When he found a new job that offered health insurance, I came back to being self employed LMT, but his employer is considering eliminating coverage for spouses. So I guess we'll see what happens when this new enrollment period. People have got to get insurance agents. They do not, they do the work for you. And just like a travel agent, you don't pay them. I have an insurance agent for everything. They do the work based on my needs and tax status. So easy. Is it easy though? Trying to get health insurance in America, single and use an alliance plan only. This means I can only use one hospital system. Between health and dental, I pay about $120 a month for full coverage, $2,000 to $3,000 deductible. Still pay a slight copays for more specialists. However, I am knock on wood healthy. All I can do is and only do all my checkups yearly with dental 2 or 3 times per year. I got an Aetna plan on Marketplace last year. In 2026, they removed coverage for my state, but luckily Illinois is offering state plans. They don't offer Aetna, so they automatically enrolled me in a new plan with Oscar. Oscar sent me an email asking me to pay my bill before giving any information about my plan or that they're my new health insurance. I had to figure it all out via Reddit thread with others in the same situation. This new plan is a lower premium, but only covers doctor visits after you meet these $9,000 deductible. That's 9K out of pocket for healthcare before insurance even pays. I don't understand what I'm paying insurance for, right? To find a new plan, I need to jump through a lot of hoops that I don't have the patience for at this moment. Currently debating going without insurance. Same boat, girl. Been without insurance forever. Thank you for starting this conversation. I grew up with parents who were self employed, so they never had insurance. I learned how to take care of myself on my own, use medical care as emergency only. Now I'm an herbalist and I've been EMT for years, so I handle most things on my own. The last few years, I try to have state insurance. I'm in Pennsylvania. It's been a nightmare. I can't get a hold of anyone to talk to, and I get denied or booted off regularly. Each year that I have been on, they took it away after a few months due to them saying I didn't upload a certain document. They never sent notices and won't let you appeal or talk to anyone. They took it again last year without notice. And I already had gone to the doctor and got several tests and even an x-ray, but no one alerted me that my insurance had been taken. So now I'm paying expensive medical bills. When I reapplied, they said I didn't upload a paycheck and request it only on the website if I logged in and checked my messages randomly, no emails or calls. So now I can't reapply anymore. I even tried to start from scratch and it said I no longer qualify. I looked at Penny, which is the PA coverage portal, and the prices are wild with hardly any coverage. I have a hormone disorder and severe asthma, so it's frustrating to lose all my meds. Thankfully, I've been managing with clean eating, fitness, and herbal remedies. It's so frustrating how they treat self employed individuals in this country. When I lived in California, I had easy state insurance and never had issues with. I feel you, girl. I feel like we're punished being self employed in all the ways, you know? I looked up cancer and broken bone treatment costs in Mexico and decided 5 years ago I'll just wing it. I cannot handle working full time in a massage on a regular job and have not had health insurance my entire adult life except for 2 years where I was a full time LMT. I save the money and can pay out of pocket for extreme circumstances, including time off and travel. I do not have any pre existing diseases that need medical intervention, which would be the last thing I would seek out should I find myself diagnosed with something. With that being said, I have floated my entire adult life as self-employed individual without health insurance. I even had cancer in 2008 and 9 and paid out of pocket for the surgeries. Wow, I don't even want to know how much that costs. I refused any and all other treatments. Everyone I dealt with was kind and used a generous sliding scale to bill me. Insurance is attached to your ability to be productive. My mother has often lamented out of fear that I should work in a profession that provides health insurance, especially in the most catastrophic event. How many of us are working jobs that we absolutely fucking hate or that are not really sustaining us overall or that we're not passionate about just to get health insurance that doesn't even pay for shit? It's so infuriating. My rebuttal is why? And here's the explanation. Building on the fact that our health insurance system is tied to our ability to work, if I had something very catastrophic occur in regards to my health where I could not work, I would then be shifted to a Cobra-esque coverage, which I would not be able to afford without working. Eventually, I would be facing medical bankruptcy anyway, so I'm able to squirrel away on a rainy day health fund insurance on my terms in the meantime. So for me, purchasing health insurance makes zero sense. I understand I am a cancer patient. I was diagnosed in 2014. I had to move to my area in 2005 in order to get insurance due to pre-existing conditions. Thank God I was able to find a large spa that offered me long and short-term disability. I ended up having a tandem stem cell transplant in 2014. My Cobra premium was almost $2,900 per month. Holy fuck. That was a drop in the bucket for chemo costs, and that was more than $30,000 a month. Holy shit. Good God. Whew. This is hard to read, y'all. I was able to purchase a policy with Blue Cross Blue Shield due to the ACA. My premium went down to $530 a month. I at least had a max out of pocket $5,500 per year. I would meet that by January 3rd every year. Cancer is a diagnosis I never expected at the age of 39. I'm thankful that I am alive. I don't know what the answer is. Each state is different. I can just tell you that I'm thankful to be alive. If you need group insurance, you might not make 50% commission, but I was able to make a living wage. I still have my long term disability. That has been the most important insurance I've ever had. Hopefully, you will never need it, but be thankful that you had it. I'm fortunate to have a partner with health insurance through their employer. Otherwise, I don't know if I could afford to be a therapist because of my health insurance. I have friends that are therapists that affects very immensely, or they go without insurance and pray they don't get sick. Same. I have EDS, and I already have a hell of a time trying to find doctors and medical professionals who even understand what the fuck it is, much less, anything else that could happen. I just have to save up and hope for the best, right? If I keep my current plan and renew, my monthly premium goes up 388%. Holy fuck. That is insane. I have been uninsured the past 2 years with Hashimoto's. I have to have a regular lab draws, and my medication is $200 for a 90-day supply on Amazon. I have 2 pills per day. Amazon Pharmacy was the cheapest I found for my med, but Mark Cuban has a more affordable prescription website for other popular meds. So I read this about Mark Cuban. I don't know enough about it, but it's definitely something to look up. And he also hates the current healthcare system. So he seems to be a little bit more promising, I think. I use Paloma Health to manage thyroid. It's an annual membership plus $60 per physician appointment. The self-pay rates at my nurse practitioner's office are 105-ish per visit, and they have self-pay contract requests for labs. I've been a part of a health share in the past, New Health, spelled KNEW, but I never actually used it. I had to cancel due to other major expenses that came up. I'm considering signing back up, but still debating since my health shares still work a bit different than insurance. My policy is going up to $150 a month without my income increasing. I'm worried I will make more than I claim to be making and end up having to pay additional. I see a specialist who doesn't take insurance, so I debate if it's even worth having. Also, my copays will be higher. This is just absolutely fucking insane, y'all, what people are going through with health insurance. It's a basic human right. Can you tell me about health shares? I've heard about them, but never really understood it. I was looking at New Health just the other day, as well as healthcare options. My husband turned 65 and went on Medicare. His insurance is through his job and won't cover me anymore. For the last year, I had insurance through ACA, but it's going to at least double, and I cannot afford that. Y'all, this is absolutely fucking insane. I wish I had answers for people. I wish that I could help you. I don't know shit about insurance at all, which is why I made that thread to see what everyone else is going through. This stuff is scary. I rely on trying to have a healthy lifestyle, taking lots of herbs, alternative medicine. I try to take care of myself, but it just kicks me in the ass sometimes. And it's so, so hard. So unfortunately, whew, my neck hurts. Unfortunately, I don't have any answers for anybody, but I just wanted to create this thread to share that we're all kind of in the same boat. And hopefully some of the information can help people while we're waiting on our government to do their fucking job. God, I I don't want to go on a rant right now about the government. I'm considering moving the fuck out of this country because I know I'm not going to be able to have affordable care. And if I have to choose between seeing a doctor and putting food on my table, or God forbid, I have enough money to do something fun, like go to a concert, whenever we have to spend all of our income just to pay for something that doesn't really do a lot for us, it's infuriating. So, anyways, I just wanted to make this video to show what people are going through and what any of the options might be. Hopefully, some of it helped. Until then, stay healthy. I wish I could provide solutions, but hopefully, some of these comments will help everyone. I know it's a really tough time right now in the economy, and I am no expert, but I wanted to go over how it is affecting massage therapists as far as our health insurance premiums. So this person writes, what type of health insurance do you have? I believe I've seen I could get it through AMTA. My husband pays around $1,000 a month for him, my son, and I. Any insight of services of insurance you would use to be helpful? So some of the comments say, check Farm Bureau. I have top tier insurance with a $3,000 deductible and pay $230 a month. I get my insurance through the ACA, that's the Affordable Care Act, aka Obamacare. Not sure going forward if that's going to be cheaper. I have not had insurance in 5 years. It's too expensive. Rarely go to the doctor anyway, but my fear, particularly as I age, is an accident or catastrophic event or major illness. I'm nearly 60. I finally found a policy I can afford and willing to pay for $110 a month for health and dental. My partner did a lot of the legwork because she knows my lack of patience with this stuff. I could never imagine paying $1,000 a month. That's just not even on the table. If I could afford that, I could afford out of pocket surgeries. I pay $87 for health and $25 for dental. This is from my own personal account. I made this post a couple of days ago. Everybody's so freaked out by insurance premiums rising, and I'm over here like shit. I didn't even have it to begin with. And I'm sure many of us are in the same boat. So the comments on this thread, I'll be dropping insurance instead of paying more and putting what could have been overpriced premiums into a savings account. So if I did need medical care, I have a fund for that. I haven't been to the doctors in years though, so I won't be paying for something that I don't use. I wanted to sign up for health insurance this year, but the cost for what you get is absolutely heinous. That's me, no health insurance for over a decade. My husband's employer plays a big part, but so do we. Just one of my scripts per month would cost us more than our portion of the premium, and I have 4 prescriptions, sadly, to manage my health. Not even with the discount cards can I afford to pay it, meaning without insurance. Plus, I've had 4 surgeries in the past 5 years, so there's that. I do not buy into sick care. I invest in myself. Same, and I just went to urgent care this morning, was diagnosed with the shingles because I'm fucking stressed out, and I also have extremely high blood pressure, so now I'm out of work for the whole week. I checked on the cost of catastrophic short-term disability, and basic coverage is $400 a month between all the insurance we pay for, car, health, and home. I'll be paying close to $800 a month. That's money I could put into a retirement that could actually incur interest. I do that instead. The cost is high and the benefits are very low. My insurance went up and I'm diabetic, so I have to keep mine. Otherwise, I will pay nearly $15,000 a year out of pocket just for my medication alone. I'm fortunate that the amount of my premium increase is still doable for me. And what I will pay my premiums, along with deductibles and copay, is still far less than I would pay out of pocket. But the difference between what I was paying for monthly premium in 2025 and what I will pay for in 2026 is a 12,500% increase. That is a fucking wild. I wish I could afford health insurance even before these hikes. I feel you, girl. I'm going to look into something like Aflac for catastrophic things since I'm getting older, but the standard medical is out of my budget. The premiums are too high. 10 years ago, I could get by without insurance on a wing and a prayer. Now I have chronic disease that requires regular appointments and medication every month. My premiums went from $80 to $400 a month for healthcare, and I cannot afford to drop it. I totally get all that is being said here. When I was younger, I got away with not having any insurance, and eventually in my 50s, a pretty basic policy. Then in early 2020 came along COVID, and my spouse and I got whipped by the long tail of this virus: heart damage, lung damage, vascular damage, brain damage, you name it. Thankfully, I had already been with the same ACA Obamacare for years. I don't know how I would have done without it. I also slipped on ice and fell in 2022 and had a concussion and was out for weeks, and I'm still recovering from all of it. All of this is to say, it can take one event to totally turn your life upside down and inside out. So, my unsolicited anti advice for all who are reading is go ahead with your plans of having healthcare in a savings account, but please do look into a catastrophic cap insurance policy that would cover you in a life changing event. A CC policy would have a low premium, high deductible, and would cover you for anything over and above what your savings plan could handle. There's going to be a lot of younger people in your shoes now, so I'm imagining a lot of insurance companies are going to be rolling out catastrophic plans that are more doable. Please find something that will work for you. Take care of yourself. Investing in care of myself, I'm dependent on the system for insulin. I've been diabetic for 20 years and had to reduce them and not get rid of them. I have insurance, but will cancel if it gets any higher. I never use it, and something I need to have tested is still so far out of reach. I dropped my insurance last year. I was paying a ridiculous premium. Every time I submitted a claim, it was denied. A month premium for a single individual was costing me nearly $600. Fuck that. And I didn't include dental or vision. I'm so scared without insurance. I'm looking at paying out of pocket for super necessary doctor's appointments and medications. And yes, these are necessary. Without them, I will, in fact, go blind. I haven't had insurance since 2022. Healthcare should not be a business transaction or a privilege. Preach it, sister. We all deserve affordable healthcare. Health, car, home, life insurance is all a scam, right? They force us to pay for it, and then the deductibles and copays are barely manageable. As a Canadian, I'm horrified at what the US has done for all the medical care. I know my taxes pay for my health care, but I can't imagine the possibility of going into massive debt because I had a medical issue. I hope for a turnaround of the system. From where I am, 900 a month and an $8,500 catastrophic cap. I'm about to get electric scooters and ditch my car. I just eat my veggies. I never bought into health insurance and I'm 64. I was just in the hospital for 3 days, emergency room first. I have no insurance. They lowered my bill from 29,000 to $8,500 and $600 for the doctor visit. This is much cheaper than insurance for myself. It is 700 for me in the marketplace and a $4,000 deductible. I'm not a fan of doctors to begin with. Most have a God complex and just try to address the symptoms with pills or surgery. Food is medicine. When I had an ovarian rupture, I was never diagnosed or educated, only told that they could do surgery or pop the other. If you want an alternative for basic care, look into primary care doctors. They are independent and don't accept insurance. They charge a monthly fee, not pricey like concierge docs for the services based on your age. It's a sliding scale. We pay $100 into each. We're in our 50s. We can text, email, or call her anytime. She does prescription orders by mail, negotiates discount rates for things like blood work, $25, x-rays, $40, MRIs, 200 with independent imaging centers as well as specialists. Visits average 30 to 60 minutes and never in a waiting room. In this current market, health insurance is essentially bankruptcy protection. Best way to view it. I spent many years in insurance. Healthy younger people do not participate in insurance is one of the reasons why it has become so expensive. If only 6 people buy insurance, the risk isn't spread out evenly among everyone. It's called adverse selection. Frankly, all it takes is one accident or unexpected illness, and you'll be spending every dime you had to pay in premiums plus some. Big, big risk. My health insurance agent recommended something that's saving me $60 a month, and I have considered no insurance and banking the savings for health costs. Yeah, $60 is barely any savings. Healthcare is one area we'll all buckle and shout socialism. Let's skip over that one. I use Amazon Health for my doctor's appointments now. They have 50 different options. Zoom calls are $50 and telephone was 35. This was over a year ago, so I'm not sure if the prices are still the same. There's a few different online pharmacies too, like Mark Cuban. I think he's trying to start that, the guy from Shark Tank. And I think Amazon can also fill a lot of the medication. It was going to cost $180 just to go see a local doctor and get my asthma medication refilled. It's such a racket. I'm about to lose my insurance if this increase goes through as planned. You can buy private insurance for less in marketplace now. It's going to be different in each state, and having a broker can help you in different products. I have complex medical issues, so does my husband. Without insurance, we will not be able to pay for medical care we need. Without subsidies, we can't afford health care. Neither one of us can get through work. I don't know how we're going to survive this. As someone who doesn't have insurance, I've always been hesitant to call an ambulance, go to the ER, or schedule the much needed procedures.
Well,
Okay, here is another post from the group. Serious question. What all are you doing who have Obamacare or state healthcare insurance? Apparently, the government is stopping my insurance and I have it through state healthcare. Just wondering what everyone is doing through these hard times as a business owner and how to prepare properly. As a sole proprietor, personal care, I need health insurance, so not having it is not an option. Last year, I royally got screwed by my insurance, paying $495 a month just to have my claim denied. I appealed and I was denied again. So I decided to invest in my own health care, as unhinged as it sounds. I just take that $495 and put it in a high yield savings account at a completely different bank. It's an automatic transfer at the same time every month. If any health expenses occur, I got it covered. The only thing I'm panicking about is I cannot work, but don't ever believe that's relevant to health insurance. I need to look into that more. I've never had health insurance. I find it fascinating that people will pay upwards to $1,000 a month, and that's on the low end, to an insurance company and have to pay out of pocket if something goes wrong. Just put that money in a separate account, then you'll have plenty to pay for everything you need. Most doctors' offices give a cash discount. Insurance is the biggest scam. Agree with you there, girl. I figured that out when I worked at a dental office and had to call and argue for my patients. You're better off putting the money in a separate health account and doing everything you can to stay healthy. I'm putting the money I was paying for health insurance into a savings account to pay for healthcare when I need it. I'm not sure if a lot of people know this, but healthcare bills can be negotiated. I had a bill for $1,100 drop down to $100 just for calling and saying I'm poor. I don't have to prove it. I could have, though. Most insurance institutions have payment plans, and usually self pay is cheaper than insurance. I haven't had insurance for over a year because I simply cannot afford it and don't qualify for state insurance. I'm living on a hope and a prayer that I'll be okay, which is probably really stupid because I also ride motorcycles. I have ADHD and have been unmedicated, and it's been pretty brutal. I do have a stash of amoxicillin in case some type of infection pops up that natural remedies won't take care of. I'm 48 and I have had never had health insurance except for as a child on my parents' plan. I don't see doctors. I know I'm one of the lucky ones who doesn't need to. The health industry in this country is insane. Well, we don't have a healthcare system. We have a sick care system here in America. I'm generally healthy, but I live in the mountains and regularly mountain bike, snowboard, among other random fun, but sometimes dangerous hobbies. I opted for health share, which is definitely more for emergencies, but has me covered. My husband and I are on a plan and want to say it's $224 each, plus or minus, for a $1,000 deductible. They set your rate based on age group and what you want your deductible to be. It can be used for 3 events per year. My friend blew out her ACL skiing and everything was covered, minus $1,000 as a 1 event, doctor visit, PT, and X number of massages and chiropractic. Plus, her doctor was writing scripts for things like ice packs, pillows, and she got reimbursed. Includes a set for annual visit, whether physical or gynecologist. Telehealth with prescription discount service. Once you're a certain age, covers mammogram and colonoscopy for men. Pregnancy costs can be applied once you're a member for a set amount of time. You can go anywhere without worrying about a network. Just go as self-pay patient and then submit everything to them. It worked for what I generally Zion Health Share is what I'm signed up for, but maybe worth looking at some options to see if there's see if it checks different boxes for you. I just want to say I'm in a similar boat, more of a solidarity comment rather than a helpful one. Healthcare is insane in the US. I got on yesterday to look at my options and it was $400 bare minimum. I barely ever go to the doctor and just want it for emergencies only. It's insane. My therapist and functional medicine physician are both self pay. So I will be foregoing insurance for now, hoping my boyfriend and I get engaged and married at some point. I just can't afford that $400, especially when they screw me over if anything were to happen. Somebody says, I'm going to marry someone with corporate insurance. Hopefully, that's always an option, I guess. Unfortunately, there isn't much anyone can do at the moment, as the inevitable rate hike is the reason for the government shutdown. There are mutual aid health insurance options as well, Google health sharing plans, or healthcare sharing ministries. Many have guidelines for eligibility or a faith lifestyle requirement. They're affordable and can fill gaps of insurance lapses. I'll follow up with a specific plan that isn't faith based, but rather a mutual aid plan through cryptocurrency investments. My husband uses it and has been affordable and very helpful option for a couple of years now. For insurance, right now I pay $139 a month, and copays I have to decide soon about upgrading diagnostics for $70 more than coverage. Found out the hard way money wise that where they process my blood work is not affiliated. So on a payment plan, I also found out where to go that is covered. You'll have to make sure with their help, if your doctors are affiliated, they have a list according to your zip code for prescriptions in pharmacies. Make sure they're generic for lower costs. Amoxicillin was about $20 less. My most recent prescription so far have billing troubles that were fixed. Is not ACA. I work on part-time with no other financial support. Live in the solution, not the problem. Healthcare marketplace, 11 years as a therapist. I think I paid $40 this year for my main insurance, $20 for dental. I just got diagnosed with cancer at 32 years old as a single mom to a 14-year-old. Oof, that's rough. Having insurance was a no-brainer. Marketplace is based on your income. As far as what they will pay for your premium is what is left for you. The only downside is you have to guesstimate what you will make the coming year, which is always hard for massage therapists, right? Always guess over, so at the end of the year, they end up owing you money instead of vice versa. The system is pretty straightforward. I'm scared. We are medically complex in my home. I have no idea what we're going to do. Has anyone looked into life insurance with living benefits? You could get a payout under certain conditions to help with medical bills, of loss of income, and medical disability. The policies I've seen are way cheaper, hopefully helpful only in extreme circumstances. I am at a loss as a single person self-employed with intermittent asthma and perimenopause symptoms, making autoimmune problems like a wild roller coaster ride. Look into local hospitals and doctors that do memberships for primary care. I'm not sure how it works anymore, but I got Aflac while I was pregnant, and that was great supplemental insurance. My insurance is going up, is doable for us, not comfortably, but doable. And I can't drop mine and pay out of pocket. I can negotiate my doctor visits and lab work, but I'm diabetic and my medication is about $1,000 to $1,200 a month if I'm uninsured. So my budget is being adjusted accordingly. I'm seeing a lot of people say put your money you'd pay for premiums aside for bills and you'll have plenty. Not to scare anyone, but I just recently was in an accident due to someone else's negligence that resulted in $350,000 worth of bills. Thanks to insurance, I'm not going to be indebted for the rest of my life. Insurance companies negotiate providers lower rates, or the retail amount would have been higher without insurance. If you go the route of getting rid of standard insurance, look into catastrophic plans that protect against this kind of thing but won't cover standard care. Okay, this is a recommendation posted by a local attorney. Let's take a look at it. Before you enroll in your suddenly very expensive health insurance on the marketplace, add it all up. Think about what you actually use and how much it costs. Consider tax planning around this latest Trump tax. The fancy silver plan all made sense when it was costing you $1,000 to $2,000 a year with free office visits, free prescriptions, and low out-of-pocket deductibles. But does that mean the plan will make sense at $5,000 a year or more? Consider getting a high deductible, zero or low premium bronze plan instead, and start a tax deductible health savings account instead. This is a HSA card. You can fund it up to $4,300 a year, $5,300 if you're over 55. It rolls over if you don't use it and can be rolled into an IRA account when you get on Medicare. Contributions into and any interest earned, and all qualified distributions are tax free. Just pay your medical bills with your HSA instead of your insurance. And if you own a small business, or a business can make 100% deductible contributions to your HSA, especially if you are a one person S Corp. It's good to know. Bottom line, you end up paying $5,000 a year for your healthcare either way, but then you get $1,000 or so tax savings under using the HSA and bronze plan, maybe more and maybe less. So that is some info to know. Here's some more advice. Look outside the marketplace. Find an agent who can help you secure something like an indemnity plan. You do need to add some riders for various needs, but I'll be paying around $240 a month for a plan I can use anywhere in the country with my primary care doc and for accidents and emergencies. It doesn't have prescription benefits, but I don't need medication. And if I did need hospital treatment, they wouldn't cover all that medication. People think they only have to use Marketplace. They don't. I'm still a student, but there's no way I'm going to be able to afford my health insurance going forward. I'll be putting my funds towards medical tourism, I guess, and hope for the best. It's criminal how healthcare runs in this country. I am totally with you on that, girl. And I've done medical tourism, nothing drastic. I've actually gone to Turkey. Well, when I was in Turkey, I got my dental work done. I didn't travel to Turkey specifically to get my dental work done, but my friend happened to have a family member who was a dentist and I needed a cleaning. So I got it done while I was there. It cost me $12, and that's because I needed injections in my gums for a deep cleaning. When I went to Mexico, same thing. It's just so much cheaper there. My dad he got a lot of dental work done in Mexico, and root canals cost $150 in Mexico versus the one to $2,000 a tooth. That's wild here in the US. And he was still able to get medicated and everything. I definitely cannot afford insurance without the subsidy. So I'll just put the money I'm paying now for insurance back for doctor's appointments and meds and stuff and hope for changes by next year's enrollment. Is insurance stopping? My understanding was it still exists, even though it will become stupidly expensive, like 25% more. My insurance already ran up by 13% last year. Can your area bear a hike in your prices? For those in private practice, these are companies. Health Savings Administrators is one in my area that aggregate small businesses. So you can sign up as one person company who provides their employees health insurance. I'm a sole proprietor. You don't need to be an LLC or an S Corp. That being said, the date my premiums have been pretty much on par with Obamacare plans, so I don't know what will happen next year. Scary times. Have you tried medical sharing program? That's what my husband and I both do as business owners with 3 kids, and it meets our needs. I haven't even been brave enough to start open enrollment yet. Mine is set to expire, and I need to renew at the end of December. I am terrified. We're going to have to go without and do a cash plan with my NP. I'm not sure how it all works exactly, but I do know that there are healthcare savings accounts. I'm a veteran, so go through them for yearly checkups because it's all paid for, but I do natural healthcare and pay out of pocket for acupuncture, Ayurvedic treatments. I take the preventative route, do meditation daily. You can see what hospitals in your area, if there are any charity ones. If it's an emergency that can wait an extra 30 minutes of driving, go there. Honestly, I have no clue. I'm a type 1 diabetic and really just hoping for another plan will come available to me through the marketplace when mine ends next June. I can't afford 1,000 each month for supplies. My daughter aged out of health insurance. She has opted to do the concierge health service. She pays $50 a month for up to 12 visits per month, 75 discount on labs and imaging. She's young and healthy with no medical issues. My only concern is the unknown. I suppose we can burn that bridge when we get to it. All of the plans are changing. It's the insurance companies that discontinue a specific plan and make you choose another that's getting more expensive. My premium is going up $450 a month, and that's just not doable for me. I'm trying to recover from a financially devastating divorce, and this increase is not doable. I have marketplace insurance, and my premium will be going up $200 next year. So I'll be dropping insurance. Just unaffordable at this point. I'm losing my insurance. I'm not sure what to do. I live in New Jersey and have to have insurance, or I pay a penalty based on my income when I do my yearly taxes. Total bullshit, in my opinion. My insurance premium keeps going up every year. I haven't called and checked for this year yet. I plan on doing that soon. It's just so expensive for a plan that's not good to begin with, but it's what I can afford. We are more fortunate than employees. We can deduct our entire premiums from our gross income. We do not receive a subsidy. We're just taking some of our deductions monthly instead of paying it at the end of the tax year. So if you're paying quarterly taxes, you can reduce the amount you're paying. There's some math involved that I haven't done yet, but don't panic. Talk to your accountant and they can figure it out. Currently, my insurance looks like it's staying the same. I have read that a bunch of the cuts don't go in effect until 2026. It's not what I'm seeing online, girl. I'm in Illinois and we have something new called Get Covered Illinois, but I have no idea how it works yet. I have lupus and I have to pay out of pocket for all of my appointments. Look into direct primary care. They are doctors' offices that charge a monthly membership rate, usually capping $120 a month. The only issue with that is that they don't take insurance. So if you need the ER specialist or a hospital stay, it won't cover that. Still a good option for primary care if you don't have anything at all. I'm grateful to be in Oregon where our state insurance is relatively secure and there is some push for universal health coverage, right? Like, get on board, America. Come on. I'm all about universal health care. Make it affordable and accessible to all of us, not only the privileged. I'll add if you don't have any name brand prescriptions, you can search the manufacturer has any copay assistance cards like discount cards after what insurance doesn't cover, or you can ask your doctor's billing department for these. I will be going without insurance until companies drop pricing. I had mine through Marketplace. I got my notice today. The price is skyrocketing. I'm about to call them and go into work to see if there's any cheaper plans. The notice did say we might be eligible for a discount, so I'm praying we are. We're almost done, folks. My husband works for a local hospital and has the most incredible benefits we have ever had. He works just enough days to cover our health insurance, grab a part time hospital job locally. Before applying, contact the HR department to see their insurance carrier is. We have Aetna. It costs us over $600 a month, so he works 2 days a week. I have 3 massive surgeries in 11 months from a dog attack and over $1 million in medical bills, and it's all covered, all of but $5,000. On the upside from him working in mental health for many years, it's also massively helped him with our clients at the practice. I haven't had health insurance in 13 years. I was recently informed about Penny, but everyone says the cost of that program is going to skyrocket. Just crossing my fingers over here. I'm 42 and would really love a mammogram. My dad died from cancer almost a year ago, and we learned his cancer is hereditary. I have no way to be tested, and this terrifies me.